what's the difference in your opinion you're employed.
Uh-huh.
I'm not, although I have an exclusive contract with our hospital, like most anesthesia groups. But
Mm-hmm.
what are things when you're looking for a job, and if you were to make a recommendation for someone coming out looking for a job, like what would you say to them as far as, what to look for as far as employed versus not employed?
Yeah.
I
think it's just personal preference. I think, I like taking care of a wide variety of sick patients overall. And in some of the employed jobs, you tend to have sicker patients with quaternary level care. Some of the private practice jobs are more bread and butter cases, and you can be more business savvy in your field, and you can actually choose how you want to take care of your patients. There's definitely pros to that. Mm-hmm. The employed model, you have administration, and there's some hurdles there, but you can also have some of the benefits, for example, of having a great EMR. You don't have to worry about some of those business ideas when you're trying to take care of patients and help them out.
Do you
I think it's personal preference.
What do you think about the autonomy aspect? Because, we've had this discussion with our group, whether you were to say sell to a national organization
Uh-huh.
or not. And the question of autonomy always comes up. And so, what sort of, you can call your own shots or whatever when you're independent. But in some ways, you're not autonomous, right? I mean, you're still dealing with insurance carriers. You're still dealing with, the hospitals where you work, and there's still all these other rules and things. And so what's your thought of autonomy for docs? Because that's one of the things that the learned helplessness is, right, a huge thing with physicians as far as making them despondent and burn out, right?
Yes.
And so autonomy is a huge part of that, right? If you don't feel like you have any control over anything.
Yes. Yeah, I think in terms of the overall, doctor-patient interaction, you want to maximize that overall. I think we have a very good autonomy now, the way things are going. I think there's other factors, though, that are playing in that make it appear less autonomous, like the EMR, like different mandates coming down from CMS, which administrators then have to mandate on their employees as well. So that exists in private practice and in employed models as well. You actually have in GI, there's a lot of private equity groups trying to buy out private GI groups.
Sure, yeah.
And they want to remain, have control of that. And some of the docs in those groups are actually going for it because it gives them the ability to kind of practice more and take care of the patients more overall. So I think with all these different changes with mergers and acquisitions and different insurance carrier changes with the way insurances will cover a group of patients versus individual ones, I think all these things play a big role.